Accurate test results depend on correct specimen collection techniques. Let's take a few minutes to review the correct methods for drawing venous blood specimens. It's good practice to gather the supplies you'll need before attempting to collect a specimen. First, if you're working from a lab order, requisition, or other form, you'll need to have that close at hand. Next, select the appropriate BD Vacutainer Plus plastic blood collection tubes for the requested tests. BD Vacutainer Plus plastic tubes are virtually shatterproof and can help protect healthcare workers from infectious diseases caused by blood-borne pathogens. As you select tubes based on the tests requested, it's a good idea to lay them out in the correct order of draw. Follow your facility's specified order of draw or follow the order of draw guidelines published by the CLSI, formerly the NCCLS. You can obtain a handy order of draw reference card from your BD representative or by calling BD at the number you'll hear at the end of this program. Drawing blood collection tubes in the correct sequence can greatly increase the accuracy of test results. Next, select the appropriate BD Vacutainer blood collection needle system for collecting specimens. Using the BD Vacutainer Eclipse blood collection needle with pre-attached holder requires no advanced assembly or special techniques. It's ready to use right out of the package. Collecting specimens with the BD Vacutainer push-button blood collection set is very much like using the BD Vacutainer Safety Lock blood collection set, but with a few important differences which we'll point out along the way. Select a tourniquet for the collection, such as the single-use BD Vacutainer Stretch latex-free tourniquet. Adopting a single-use policy for tourniquets can reduce the spread of infection and can reduce the risk of cross-contamination. Depending upon your facility's policies and procedures, you'll also need gauze pads, bandage strips, and 70% alcohol prep pads, such as the convenient BD Vacutainer alcohol swabs. To perform the collection using the BD Vacutainer Eclipse blood collection needle with pre-attached holder, apply the tourniquet and choose a venipuncture site according to your usual procedures. Cleanse the site and allow it to air dry. Then perform the collection according to your facility's guidelines. Fill the required tubes, mixing tubes by gentle inversion, never by rapid or vigorous shaking, which can cause hemolysis and invalidate test results. Information on the number of inversions required for each type of tube is available on BD's Order of Draw guide. After the last tube is filled, withdraw the needle and apply pressure to the venipuncture site and bandage appropriately. When using the BD Vacutainer Eclipse blood collection needle with pre-attached holder, immediately shield the needle by pushing the pink safety shield forward with your thumb on the thumb pad. An audible click will confirm that the shield is locked in place. Then, immediately dispose of the needle and holder as a single unit in the nearest sharps collector. If you've chosen to collect samples using the BD Vacutainer push-button blood collection set, select and prepare the site as we've just discussed. Peel back the packaging at the printed arrow to expose the entire wing set, and grasp either side of the rear barrel of the wing set with your thumb and forefinger. Remove the set from the tray, taking care to avoid pressing the activation button, which is clearly marked with an indicator arrow. Perform the venipuncture using your usual winged set technique, either by holding the wings together or by grasping the body of the set. Notice that the indicator arrow on the button shows you exactly where the blood flash appears as the vein is entered. Pay close attention to both personal safety procedures and proper aseptic handling techniques, and remember to fill a discard tube first, following your institution's guidelines. A BD Vacutainer No Additive Plus plastic tube can be used as a discard tube. Using this technique to fill the tubing with blood ensures that the first tube collected will contain the correct amount of blood to mix with any additives present. The BD Vacutainer push-button blood collection set is designed to be activated while the needle is still in the vein, after the last specimen tube is collected. When you've removed and mixed the final tube, place a gauze pad on the venipuncture site, making sure it covers the edge of the front barrel. While maintaining contact with the patient and without withdrawing, hold the device by the rear barrel with the thumb and middle finger, and activate the safety feature by depressing the button with the tip of the index finger. The needle will automatically retract from the vein. To ensure the complete and immediate retraction of the device, be sure to keep fingers and hands away from the end of the blood collection set during retraction. Apply pressure to the site according to your facility's protocol. Visually confirm that the needle is in the shielded position and immediately dispose of the entire BD Vacutainer push-button blood collection set and holder in the nearest approved sharps disposal container, following your facility's policies and procedures. To help you sharpen your phlebotomy skills, here's a collection of key points to remember during venipuncture as recommended by BD's ASCP certified medical technologists, part of the BD Vacutainer Technical Services team. Always wear gloves when working with blood or body fluids. Allow the alcohol to air dry after cleansing the venipuncture site. The tourniquet should remain on the patient's arm no longer than 1 minute. Remove the tourniquet as soon as possible. Be sure to check the expiration dates on Vacutainer blood collection tubes. Never use expired tubes. Always follow the correct order of draw. Mix all tubes, including plus plastic serum and SST, with the proper number of inversions. Immediately activate the needle's safety mechanism and dispose of the needle or blood collection set, along with the holder, into the nearest appropriate sharps container. Always be sure that all bleeding has stopped before leaving the drawing area, and label all specimens according to your facility's guidelines.